Ever since the MASS trial got published in 2002, a huge amount of progress was made in the subsequent years. It required a lot of lobbying. In the end, the Department of Health agreed to introduce the AAA screening program in 2008, and that was after the National Screening Committee agreed that this was worthwhile and would be cost effective in terms of qualities. Shortly afterwards, in 2009, early implementation started in England in 6 centres, and then it was rolled out nationally and fully operational in 2013. So it's been going on for a good 9 years. We'll have our 10-year anniversary next year. What's happened in terms of results? Well, over 3 million men have been offered screening. Over 2 million have taken up the offer. 8,000 men have been referred for AAA surgery who reached threshold size. Around 6,000 have been operated. The results are excellent in terms of 30-day mortality being 1.22% overall for both endovascular and open surgery. Obviously, it's lower, it's around 0.5% for EVAR, it's about 1.7% for open. Still very acceptable by international standards.
The challenges in London, 2018, North London aneurysm screening programme came together. So North Central, North West, North East came under one roof, and that brought its own challenges, but also huge achievements have been gained in those few years. And then more latterly, since the autumn of 2021, we've been overseeing and caring for the South London screening programme and helping them to come back up to speed. And that's mainly because of COVID. We all think that COVID has disappeared or it's very much in the background, but the consequences, and we all hear about restoration of services, very much so with the screening programme. We've got a large cohort of men who have not been invited, and indeed that's what we're working on.
One thing that what we've seen is that the pickup rate in MASS trial was above 3%, but we've never been able to have such a high pickup rate in the national screening program. Currently, it averages at 1.11%. We have done cost effectiveness analysis, and we think that the program will remain cost effective even to a pickup rate of around 0.5%. What else has been shown today? I presented some figures looking at what's happened to mortality from ruptured aneurysms in UK, and there are some signs in the data now showing that the AAA screening program has begun to have a beneficial effect, certainly in reducing mortality from ruptured aneurysms in men.
In London we have the challenge that the most deprived, and that's not an insignificant number of men, they don't come, and we have to work together with those communities to reassure them and invite them in for screening because they're most likely to have aneurysms.
Next year is our 10th anniversary of the program being fully operational, and I think we should use the opportunity to highlight the program and particularly encourage men that may have missed screening or those that haven't taken up the offer of screening, because we know, as Meryl has said, that the most deprived that are highest at higher risk of developing aneurysm disease are the ones that we struggle to engage with. And the other thing is, nationally, we have developed a toolkit to allow local providers to try and work out ways and strategies on how to increase the uptake in those areas.